Hello, it's Dr. Seth Jarrell. I want to talk to you about migraines. So, migraines. What are migraines? I think it's a common misconception in the community and even amongst some providers what a migraine actually is. If a headache is bad enough for you to see a doctor about, it is most likely a migraine. So, a migraine is, think of it like a seizure. It's an activity in the brain cells that starts out really small and it's an irregular signal causing some pain. That signal then starts to spread and spreads more and more and more and more as time goes on. That's really important because we deal with treatment in different ways because it's a migraine versus just a regular headache. There's some things you can see with migraines. There's auras where you kind of have some specific things that happen right before it. You can see spots. You can get very, very light sensitive. You can respond by sleeping and it gets better a lot of times. There's a lot of things with migraines that have their own specific features, but you don't have to have that to have a migraine. So, what causes migraines? Well, you were most likely born with a predisposition to get migraines, but there's also some other triggers. So, sleep. So, too much sleep, too little sleep, or the change in the timing of your sleep. Those are some common triggers of migraine. So getting your sleep under a normal habit is extremely important if you have recurring migraines. So going to bed at the same time every night, getting up at the same time in the mornings, and getting 8 to 9 hours of sleep at night. So diet can also cause some migraines. So we know that people who miss meals and the people who are predisposed to migraines and they miss meals, that can cause a migraine. Change in the amount of caffeine or the timing of your caffeine can cause a migraine. So if you're drinking caffeine, make sure you're doing it at the same time and the same amount, not changing it up a lot. Certain foods, so foods that contain tyramines, nitrates, and xanthines can all cause migraines. Now, not everybody has this problem, but some people do. So keeping a food diary is really important. So tyramines are things in wine, aged cheese, dairy, yogurt, chocolate, beer, nuts, beans, legumes, bananas, liver, figs, prunes, raisins, pineapple, soy sauce, MSG, vanilla, yeast, pickled, and salted fish. Lots of things, right? So keeping a diary of whenever you have a migraine of what you ate that day is extremely important. Nitrates, so those are things in preserved foods such as hot dogs or in meats that are cured. Also xanthines, so those are in dyes, in foods. Certain foods have xanthines, and then certain medications actually have xanthines. So keeping a diary of all these things is extremely important. So how do we treat migraines? Well, first, let's start with the acute treatment of migraines. So when you have a migraine, the most important thing for you to have on hand is something called an anti-inflammatory medication. So things such as certain anti-inflammatories are ibuprofen, also known as Advil, Aleve, also known as naproxen, and then some non-over-the-counter things are things such as indomethacin. So having something like that on hand is extremely important. The second thing that's important about those types of medications are that a migraine usually lasts for at least 8 hours, the activity in the brain at least. So if you take something that is short acting, so something that only lasts 6 hours, such as ibuprofen, or it's also known as Advil, that may or may not completely knock out the migraine. It may come back because the Advil lasts for 6 hours, but the migraine lasted for 8. So I usually recommend something long-acting, such as Aleve, which is naproxen, first line at least. The important thing is that you treat them early. So on a scale of 0 to 10, with 0 being no pain and 10 being somebody put your head in a vice and is squeezing it until it explodes, you want to treat it at a 2 to a 3. That's because the activity is still small and we can knock it out. If you treat it at a 2 to a 3, you take your anti-inflammatory, then you wait. You wait 90 minutes. If that migraine is not gone, you take another one. That's important. So if it's not knocked out within 90 minutes, you take a second one. Now the doses of the anti-inflammatory should be very high. For ibuprofen, even though I don't recommend ibuprofen, it's 800 milligrams. Naproxen, it's 500 milligrams. So let's take for instance, in an ibuprofen tablet, that's a 200 milligram tablet that you get over the counter. So that'd be 4 of those. In a naproxen, that's a 220 milligram tablet. So it's technically 2 of them, but a little bit more than that because that doesn't add up to the 500. So I usually write a prescription for that. You should not take more than 8 of those a month. No more than 8. If you take more than that of Aleve, ibuprofen, naproxen, Excedrin, things like that, that can actually cause something called chronic migraines or chronic headaches, chronic daily headaches. That can actually be a cause of it. We need to slowly wean you off and put you on something else. We can eventually go back to that, just no more than 8 times a month, but that can actually be a severe cause of migraines. The next type of medication that we add on is something called a triptan. So a triptan is a type of medication that works specifically for migraines. So the triptans, the most common side effects that we see with those are people get some flushing right when they take them. Sometimes they get an intensification of the migraine right at first, but then it goes away. And sometimes people get a little bit of nausea, and it makes them pretty sleepy, and they want to go to sleep afterwards. So if you're at work, it may not be the best option for you. But triptans, common ones of those are called Imitrex, Maxalt, rizatriptan. There's some newer ones called Onzetra that you do in the nose. Some of them are injectable and some of them are by tablet. Sumatriptan's another name. Triptans are good. It cannot be used in anybody who's ever had a stroke, though. They can cause some vasospasms of some of the arteries. So if you've ever had a stroke, don't let anybody give you a triptan. So how do we use triptans? Same way. So we took that anti-inflammatory, such as naproxen. We waited 90 minutes. We took another one, it didn't go away. Now we wait 90 more minutes. If it hasn't gone away now, we take a triptan. We wait 90 minutes. Take another one. Not going away in 90 minutes, you need to let somebody know. You need to either call our office and make an appointment. If it's an emergency, you need to go to the emergency room because it could be something more serious. Sometimes in people that have severe headaches, severe migraines, I'll do both at the same time. I'll do the naproxen and the triptan at the same time. But let me make that decision for you, okay? We will talk about that in a visit and talk about how we can better control your migraines. Once we get them controlled with these acute treatment plans, it makes mine and your life a lot easier. Okay, let's talk about chronic migraines. So chronic migraines are somebody who's having migraines almost every day. You can't knock them out. So chronic migraines, about 80% of them are actually from rebound headaches, from use of medications that probably should not be used at all. So opiates, so things like Norco, Percocet, codeine. So as little as 8 days of use of these every month can cause migraines to be chronic and daily. Now, the big issue with that is that sometimes people treat their headaches with these, and that's not a good choice because these medications in general can cause migraines to be worse in the first place. They cause the brain tissue to be more irritable. Other medications such as barbiturates, one of them that's commonly given is Fiorset. So as little as 5 days a month can cause one of these chronic daily headaches or these rebound headaches. Benzodiazepines is another class, so things such as Xanax, Valium, alprazolam, those types of medications, if they're used more than 5 days a month, can absolutely cause some chronic migraines. And then the medications that we normally use, the anti-inflammatories that we talked about, like ibuprofen, naproxen, diclofenac, Aleve, aspirin, Advil, those kind of things, if they're used in high doses for over 8 times a month, they can cause chronic daily headaches or rebound headaches. So that's why we encourage you not to take it more than 8 times a month. Okay, so let's talk about prophylaxis for migraines. So some people are still having quite a few migraines despite doing this acute treatment that we've already talked about. And they're having many episodes a month. How many is many? If you're having more than 2 days a week of these migraines, or you're having more than 8 migraines a month, it is time, after we've done the acute treatment that we talked about and weaned off of any anti-inflammatories that you've been taking too many of, or any other medications you've been taking too many of, it's time at that point to start a prophylactic medication. So what does that mean? That means a medication that can keep you from having too many migraines. Now, this isn't, for the most part, going to cut your migraines out completely, but it does decrease the amount of headaches that you have, usually by half. So if you're having 10 a month, now we're down to 5. So there's some mixed evidence about which medications can be used for migraines. There's different classes. There's some over-the-counter stuff you can actually do in herbal supplements. So let's talk about those first, because they have the least amount of side effects that you can get from taking them. So one of them is called butterbur root. So butterbur root actually has some good evidence. It's at 50 milligrams 3 times a day, or 100 milligrams twice a day. And you do that for 4 weeks, and then you cut back to 50 milligrams twice a day. The problem is that it's not regulated by the FDA, so we don't know if what you're getting is actually butterbur root. And there's no really way to tell. So we can try it and see, but if it's not working, then we scratch it. Some other ones are riboflavin, which is a type of vitamin. Let's see here. Magnesium is another one that can commonly help with migraines, especially in pregnant patients. I'll put pregnant patients on magnesium because it has no effects to the child. And vitamin B2 can also help with migraines. So these are some things that you can supplement in your diet or in your vitamins to help to prevent migraines. So after that, what kind of medications can we start? Well, the best evidence is with things such as beta blockers. So propranolol, timolol, metoprolol. Those have side effects that we would need to discuss and make sure you don't have any kind of contraindications to those. Topiramate, which is also known as Topamax, and valproic acid. Now, the problem with valproic acid, or Depakote is another name for it, is that it can cause some weight gain. So if you're having any more than 8 a month or more than 2 days a week, then we need to just talk about starting one of those. The second level of evidence, right below those medications, are with medications such as tricyclic antidepressants, so TCAs. Some of those are amitriptyline, nortriptyline, imitriptyline. Another one is a beta blocker called atenolol. There's also use of botulinum toxin, or Botox. That has to be done by a professional who's been trained in that, such as a neurologist. They inject it at the base of the skull, and that's done every 3 months. And then venlafaxine, which is a type of antidepressant, has been shown to decrease migraines. And those are all second line. We usually titrate the medicines up over 2 months, and then we try to wean the medications down after 1 year to see if we've had any improvement. Some other things we can do is called boot camp. So I call it migraine boot camp. So you have to keep a diary and be very strict about what you're eating, sleeping, very strict about your exercise, all at the same time, and all on a regular basis. So where do we go from here? Well, the number one thing is I need to look at your medications, and we need to determine, do we need to slow down on some of the dosing of some of them, or some of the frequency of some of them? Do we need to come off some of them? The second thing is you need to start keeping a diary, a food diary of the things that you eat that may have triggered a migraine, a sleep diary. How much are you sleeping? What time did you go to sleep? So on and so forth. And you need to be vigilant about exercising. The third thing is the acute treatment plan that we talked about. So we start with the anti-inflammatories when the headache hits a 2 or a 3. We take one. Wait 90 minutes. Not better, take another one. Not better, after 90 minutes, then a triptan. Wait 90 minutes, not better, a triptan. Not better, call me and let me know. We'll make sure we get you an appointment. The fourth thing is if we're having more than 8 a month or more than 2 a week, then we need to talk about some prophylaxis. And it may take more than one prophylactic medication to get you where we need you to be. And then lastly, if you're having those chronic daily headaches from taking too much of some of these other medications, we may have to take you off of those. And in the meantime, we start some things to help you get controlled. So it may take some steroids for a while. It may take some Tylenol for a while. It may take some prophylactic medications for a while. but we're going to get you off of those and get you on a good plan. There's hope. Promise. We're going to get through this together. If you have any problems, please call. Let me know. If you want to address anything today, please let me know. We'll get you taken care of. Thank you for your time. Have a great day.